Every day, members of the Alliance for Continuing Education in the Health Professions contribute to the value of CE and CME, value in clinician performance and therefore patient outcomes, value in population health, value in quality improvement organizations, and much more. You're watching the CE and CME Matter campaign.
Over all the years of working in the hospital settings and in healthcare, health system settings, the thing that never occurred was collaboration and interprofessional education between the physician, the nurse, the pharmacist, the social worker, other ancillary members of the healthcare team. And I do believe that through medical education, we're finally going to get there.
I think the challenge that we face is that while we all believe that and understand that within the CME community, I believe that there are many outside of our world that have absolutely no concept of what we do or even that we exist.
As healthcare educators, we identify where the gaps are in local, regional, national levels, and then we develop certified education to meet those needs.
Now let's bring it down to the patient. We've taught the clinician. Now how does the clinician teach the patient? And again, it's finishing up that circle.
We are, I think, the thread that weaves it all together. If we develop an interprofessional educational activity that brings together all of these different constituents of the healthcare system, and now, look, we're even beginning to incorporate the patient voice into our medical education.
And one of the barriers that is widely discussed is the patients themselves. They can be barriers.
I tell my staff all the time, we may not be practicing healthcare professionals, but we still, every day, have a huge impact on how patient care rolls out.
And so I see continuing medical education or continuing education as being the vehicle to occur, to make this happen, what we haven't had up until now and what we can now have for the future.
If all of our missions and visions and goals are the same, and that is to improve healthcare, let's then say what we are. And we are healthcare improvement organizations, and I think when we can shift the focus or shift our thinking around that, we stop looking at education as simply one-off events to improve knowledge or improve the knowledge transfer. But I think we start looking at it in a different way that says we're looking at the long-term play here with these healthcare providers and the role that we play not only now but downstream in ultimately improving the care that they deliver.